for 2023. We have Angie on the phone. She is our part of our benefits team with our brokerage. This year we were able to do a couple of new things that we've been trying to get done over the last couple of years. We were able to get our premiums lowered with moving over to United Healthcare. Our family deductibles have gone down. We added an HSA plan. I know it was important to a lot of people to get added, and then we were able to add child orthodontics also. So we've made some pretty good improvements this year to our plan, and we'll let Angie go ahead and get started and start going over it with you.
All right, thanks, Christina, and thank you everybody for joining. As she said, my name's Angie Green. I'm with Alara Group, and we are the broker that has partnered with MCSG earlier last year and really did some good work together this year on, as Christina mentioned, just trying to provide and the benefits that people have really been wanting to have with some additional things added, and really got a good thing back from United Healthcare. So with that said, I'm going to share a copy of the benefit guide. The copies have not been sent out to you just yet. We're going to get some finalizations done on it, and they will be provided to you prior to open enrollment opening on the portal on Wednesday. So they will be coming to you here soon. But for now, I'm just going to walk through the version and just kind of go over the guides or the benefits that way. I will stop along the way and ask questions. If you want to unmute yourself to ask questions, you are more than welcome. And there's also a chat box I will check. If you just want to throw a question in the chat, I will stop and pause to read those as well. So let me get my screen shared here. Sorry, a little delay there. Okay. All right, so this is the open enrollment meeting for the 2023 benefits, which run March of 2023 through February of 2024. As you know, we mentioned we are changing. Sorry, I'm trying to get this display. There we go. Sorry about that, everybody. Oh, that was the wrong way. I'm not at my normal desk, so I apologize. I'm fumbling around a little bit here. Full screen mode. There we go. Okay. So as mentioned, we did move the medical benefits to United Healthcare, so I'll spend quite a bit of time on that. And then we'll also talk through the other benefits and of course, open it up for questions for anybody. So here's a copy of the guide. As I mentioned, you will get a copy of this prior to open enrollment beginning on Wednesday. There's a few pages I do want to point out. So we have a, I need to move this. Okay, we have a page that has basically all of your benefits, the carriers listed, the websites, the phone numbers, anything like that. So it's kind of a quick cheat sheet to just remember that you have available in the guide. Sometimes halfway through the year, you forget where to go, what carriers what, and how to get their information. So this is a good cheat sheet to remember that you have. The next page just talks about eligibility and enrollment. So just as a quick refresher and reminder, you're eligible for benefits if you're a full-time employee working 30 hours or more per week. Your spouse and dependent children up to the age of 26 are also eligible to enroll as well. If you are a new hire, you're eligible for benefits on the first day of the month following the date of employment. So if you were hired in the month of February, you are eligible for benefits to begin on March 1st. And then for everybody else, this is your annual enrollment period. So this is a time that you want to really take the time and make your choices for the next 12 months ahead, beginning March 1st, to make your elections, make any changes or anything like that to go along the way. There are a few items that you can are a few instances where you can make changes to your benefits throughout the year. Those are qualifying events that are, major life events. Some examples are marriage, divorce, birth, adoption, death, kind of the big events like that. And the one thing to keep in mind and always to point out, you do have a 30-day window to make those changes. So if you have some type of life event happening, make sure you are getting with your HR team or logging into your benefits portal to submit the qualifying event in order to make any changes or adds that you or drops that you need to get done. Beyond that, you can't just drop coverage just because you're not using it halfway through the year. It does have to be due to a qualifying event. Okay, so the next page talks about, this is just kind of a quick summary of the 4. So there's now 4 medical plans available to you. This is just a quick breakdown. So it talks about, we did add a high deductible health plan, which I'll go into more detail on the next few pages. And then there's 3 PPO plans available that are similar, very similar to what was previously offered with Blue Cross. Okay, so I will spend the majority of the time here. There's a lot of information and I don't want to overload you, but at the same time, I want to be sure we're talking about, kind of the key points. So I'll go through the pages and then pause for questions. Again, feel free to add anything in the chat. So the medical benefits this year are with United Healthcare. They all have the Choice Plus network, which is their largest network. This first plan here is the high deductible health plan. This is the new plan that has been added. So with that, there is an HSA account available that will be that you are eligible to have to, we'll kind of go into some further details on that, but MCSG will contribute certain dollars into that per month, and as well as you can put pre-tax dollars into that HSA account for spending on your medical, dental, vision benefits for your choice. And like I said, we'll kind of go into more details on that. But the way the plan works, it has a $3,000 deductible or $6,000 if you're a family. And then it has 20% co-insurance. So basically what that means is after you've hit that $3,000 deductible, the 20% co-insurance will take effect and you'll pay 20% of all costs up until you reach this out-of-pocket max of $6,350 or $12,700 for a family. So your cost, your out-of-pocket exposure goes down quite a bit after that deductible, but you're still, this is the absolute out-of-pocket max you're looking at spending for that annual or for that calendar year deductible. Beyond that, the way the high deductible health plans work, if you're familiar with them, everything outside of preventive care is all applied and subject to deductible. So you don't have copays or anything like that. If you go for an office visit, you get what we call is the in-network negotiated rate. So there's between your provider and United Healthcare, there's a negotiated rate for the services and things done. For example, I'm on a high deductible health plan, and when I take my kid to the pediatrician for just a sick visit, I don't pay a copay at the office, but I get billed for that visit. And it generally runs, I think mine is like $108 or something like that for my pediatrician. It varies. But again, depending on what it is, you'll get that EOB and negotiated rate bill back from what you owe. And all of that gets applied directly towards your deductible. And that's where you can use your HSA dollars to spend on that if you choose. The couple things to point out, so preventive care is covered at 100%. There's no copay. As long as it's preventive care, it's covered. You will not get billed for that. And then your virtual visits, we have a note in here, it's approximately $49, but that is applied towards your deductible. So when you use your virtual visit option, they will charge you about $49. It should be about that. Sometimes it fluctuates. And then all of that still gets applied towards your deductible. So it's technically not a copay, but it's still that amount. And then as far as your RX goes, your prescriptions, all of that again is subject to deductible. So it will be whatever that negotiated rate is for whatever prescription. Once you've hit your deductible, then you do have a copay of $10, $35, or $60 on the 3-tier program. So those copays are only effective after you've hit this deductible. Otherwise, it's the same things, all that subject to deductible. The second plan that we have on this page is your base PPO plan. So this one is going to be similar to the base plan that you previously had with Blue Cross. Again, same network, and there is the FSA, the flex spending account, that's still available to you to enroll in if you choose. This plan is a $3,000 deductible. It has a 30% coinsurance. And so after that $3,000 or $6,000 deductible has been met, you'll pay 30% of cost up until your out-of-pocket max of $7,000 or $14,000 for family. Again, preventive care is covered at 100%. And then this plan is more of your traditional plan with the copay. So there's a $30 copay for office visits. The one thing I do want to point out, so United Healthcare has a nice feature for children under the age of 19. There is a $0 copay for all children, whether it's a sick visit or whatnot, that is in there available. So that's a really nice feature. I think is great to point out. If you have children on your plan, you don't have to pay that $30 copay each time you're taking your kid in for a sick visit. Virtual visits are covered at 100%. And then your office visit specialists, those they have a couple tiers, there's 30 or 60. Basically they have under their in-network specialist, they have preferred and non-preferred. So even though they're still in network, if they're preferred, it's still a $30 copay. If they're non-preferred, it's still covered and considered in network, it's just a $60. And you can look up your providers in advance. I'll kind of pause here. So you can look up your providers in advance on the United Healthcare website, and you can do it without having a member ID. If you go to myuhc.com, and then from there you can do look up provider and search. It will ask for your network. So be sure you're looking under the Choice Plus, and then you can search by provider name, by the hospital or location, or you can just do a search to see what's available to you. And if anybody has any struggles with that or issues, we will get some flyers out to you and available on the portal to kind of help with how to find my provider. So there's more of a flyer that you can refer to on that, but we'll be sure to get more information on that. But if you have any troubles or are not able to find something or having a hard time, definitely let Christina or Kristen know, and they can get with me and I can work with the UHC team. We're always happy to help that way. Also, if you have kind of more specific questions for, I currently have this coverage with Blue Cross. What do I need to get next with United Healthcare? What is this going to look like for me? If you have more specific individual questions, you can, if you don't want to send them to Christine and Kristen and include all the detail, you can just let them know and they'll link you with me and we can communicate that way with, and I can get that over to United Healthcare to help answer your questions. So definitely ways to help answer if you have more personal specific questions, if you're struggling on kind of figuring out your provider information, anything like that, definitely let us know. Let's see, what else did I want to add there? If there's, again, we'll have flyers that we'll send out that will be available that I think will definitely be more educational, but I strongly encourage you to use the MyUHC website. And then once you get your member IDs, there's the mobile app and the website that's it's a very robust, user-friendly system. So I really like the MyUHC app and website. So don't be afraid to register and use that and check it out because it has a lot of great tools for you to use. Okay, so I will go back now to the benefits after that little breakdown. So with that said, after office visits, the specialist is a $30.60 copay, as I talked about. Your simple lab and x-ray are all covered 100%. So you'll pay your office visit copay and then that's covered. Any complex imaging such as CT scans or MRIs are subject to deductible. Your urgent care is a $50 copay. Your emergency room is a $250 copay plus the coinsurance. And then your outpatient and inpatient services are all subject to deductible. So again, when I say subject to deductible, that means you'll get that in-network negotiated rate, you'll get the bill on what you owe, and that all gets applied directly towards your deductible. The copays on this plan for pharmacy are 3 tiers. It's $10, $50, and $100 for the 3-tier. And then on all mail orders for United Healthcare, it's 2.5 times the retail rate. So there's a little bit savings you can get on doing the mail order for 90 days. Before I go on to the next 2 plans, I do want to point out, so as we know, the plans, your elections all begin March through February. However, your deductibles run calendar year. So if you currently have a deductible that's you've already, have some money applied to on your deductible with Blue Cross, we will work on getting those transferred over to United Healthcare. It takes a little bit, I would say kind of 60 to 90 days at the most. So there is a little bit of a time frame in there where it won't show up just yet. But we will work on, if we need anything specific from you, we'll let you know, but we'll work on getting that report from Blue Cross over to United Healthcare, and then they'll work on submitting and getting those applied. So they will carry over, they will transfer over. There'll be a little bit of a timing in there where it won't show up immediately. So if you have any questions or issues around that, definitely let me know. And then also, I do want to point out before we get too far into it, if you are currently enrolled in the FSA plan, you will not really be able to elect the HSA or make contributions or use the HSA, because there's, we'll get into it in a little more detail. So if you're already using an FSA, those dollars cannot, you can't double dip, I guess is the best way of saying it. You can't use FSA dollars and HSA dollars. So if it's something you want to plan for in the future, and next, if you want to enroll in the high deductible health plan, but you already have your FSA, you can continue to use that. You just can't use both the FSA and the HSA. And then the following year, you can absolutely drop the FSA. This year you would drop the FSA and then use your HSA dollars. But hopefully that makes sense. If we have kind of more questions around that, let us know. We're always happy to answer things a little more individually. And if Christina, if there's anything you want to add to that, you are welcome to. Okay, so somebody asked a question. They're on my UHC website and found my provider, but how do I tell if they are 30 or 60 visit? So if they are a specialist, they should have listed next to them, and I might be wrong on this, they should have next to them if it's preferred or non-preferred. If they don't, I will have to take that offline, and I can help answer that question afterwards. So let me jot a note down. If you want to if you want to let me know, I can look into that further. Okay, and then I have another question. Can I continue to use a HSA from a previous employer if I have FSA? So HSA dollars that you've already contributed are always yours. The HSA dollars are not a use it or lose it like your FSA are. So if you already have HSA dollars that you contributed in a prior year, you can absolutely use those dollars. The rule is you can't continue to contribute to an HSA and an FSA. The contribution, you can't continue to contribute to your HSA if you're using FSA dollars, I guess, if that makes sense. You have to be in the high deductible healthcare. You have to be enrolled in a high deductible healthcare plan to be eligible to contribute to your HSA. But if you're using FSA dollars to pay for a medical expense of some sort, then you cannot use those HSA dollars to also. And there's some, I guess, lining around that. So after this meeting, I will kind of collect a more compliance written solution paragraphs, because I feel like I'm kind of talking in circles and I don't want to confuse anybody. So we can get kind of a prepared statement so that it's a little more clear form on how that works, and make sure that gets out to everybody on how that works if you currently have a FSA but you want to move to HSA, so that I don't get any confusion or say something in the wrong way that's taken. But if you currently have HSA dollars, those are definitely your dollars to use. What is the URL for United Healthcare without login? So you can still go to myuhc.com, and then I believe when you're looking up find a provider, you just choose not a member yet, or something along that line. There's not a preferred or non-preferred on that page. Okay. Okay, I am making these notes, Dan. I will get a little more detailed information out to everybody. We'll get a flyer on how to find my provider, and then I'll get some specifics on how to determine if they're preferred or non-preferred. So I will be sure we get that data out to you guys and information out to you guys. Okay, can we transfer an existing HSA to the new HSA? Yes, you can. The HSA will be through Advantage Benefits Plus through the same bank as what your FSA is with. And that is, again, totally your choice. Your HSA dollars are yours. You can do with them what you want. So if you currently have an HSA bank that you use and you want to transfer those dollars into the current one, you can absolutely do that. That will all have to be done on your end because it is your bank account. But yes, you can do that. Okay, and then somebody said, I am with Humana. How does that fit in here? I don't know if you're currently on an individual plan with Humana or on a spouse's plan. I don't know exactly what you mean. But if you are on a different plan outside of the group benefits with Blue Cross, you have the option to enroll in benefits with United Healthcare effective 3/1. You just, as far as the deductible transfer, anything like that, that is not something we can do outside of the current group plan with Blue Cross. So if you're moving from a spouse's plan or a individual plan or anything else and want to elect the current benefits with United Healthcare beginning March 1st, we will not be able to get a deductible transfer with that. Okay, I think I got all the questions. Again, I know some of you I didn't give a very clear answer, but I'm making notes, and I will be sure that I get this addressed and I get the information out to you that's being asked, specifically around the HSA, FSA questions and the provider lookups. Okay. Yeah, I'm not sure, Christina, if you can help answer this. They said they joined Humana with MCSG 3 years ago. I don't think there's currently a Humana plan.
Are you on TRICARE right now? Because I don't think you're on our medical. We can discuss offline, Kurt, also.
Okay. Yep, let us know, and I'm happy to assist with anything I can in that way too. Okay, good questions. I appreciate people asking. That helps. And like I said, if I am not getting a clear answer or a good answer to you, I will be sure that we get that addressed. Okay, so moving on to the next 2 pages. These are the next 2 plans available. So there's a total of 4 plans available. We went over the high deductible health plan and the base PPO. On this page are the mid PPO and the buy-up PPO. They're going to work extremely similar to your base plan that we went over, other than they have a different deductible and their copays vary just a little bit. So with the mid PPO, again, you have the FSA that you can enroll in as well, just not the HSA. The individual deductible is $2,500, the family is $5,000, and then there's a 20% co-insurance. So again, after you've hit that individual or family deductible, then you'll pay 20% of cost up until the out-of-pocket max of $6,000 or $12,000 for a family. Preventive care is covered at 100%. Your copays are also $30. The same thing applies to all of your PPO plans, where it's a $0 copay for children under the age of 19. Virtual visits are covered at 100%. The same thing with the specialists, it's either $30 or $60, and I'll get more information on how to figure that out to everybody. Your simple lab and x-rays are covered at 100%. Your complex imaging, again, is subject to deductible. Urgent care is $50. Emergency room $250 copay plus the co-insurance, and then your outpatient and inpatient services are subject to deductible. Your retail, it's again 3 tiers, but it's a little bit different. It's 10, 35, and 70 for your copays on pharmacy. And then for your buy-up plan, same thing applies. So same network, you can have the FSA. This deductible is a $1,500 deductible or $3,000 for family. Then you pay your 20% co-insurance after deductible up until your out-of-pocket max of $3,000 or $6,000 for family. So that's the total out-of-pocket you're looking at spending for that entire year. Of course, the premiums are higher, so that's kind of where you want to look and decide what makes the most sense for you. The richer the plan, the higher the premium. So again, that's for your own individual decide on how to decide what makes the most sense for you. And then the benefits itself are very similar, other than there's a few copays I'll point out. So on the office visit buy-up, the copay is $25 instead of $30, but the children copay is still $0 for children under 19. Your copays for specialists go down a little bit to $25 and $50, and then everything else is the same as the other 2 plans. Your simple lab and x-ray covered at 100%, $50 urgent care, $250 for emergency room plus co-insurance, and everything else is subject to deductible. And the pharmacy is the same as your mid plan at the 10, 35, and 70. So I will pause there again for any questions on any of the benefits. I think there's a few more in the chat I'll go look at here. I already have an HSA account before employed by MCSG. Can my new enrollment to MCSG HSA that will apply to my previous HSA account? So MCSG, because they're making employer contributions, all of those HSA accounts will go into the one HSA account through Advantage benefits. If you have another HSA account, it's to do with what you want. If you want to transfer those dollars from the MCSG account over to your current HSA, you can. Again, there's not a way to set up, if we set up individual accounts for everybody on what their preference was, that would just be way too much work and room for error, I guess, on the MCSG side. So there's no way to make that, but you can do with those dollars what you want once they're in that account, I guess. And you can make your own contributions into a different HSA account as well. You don't have to use the one set up through MCSG. Is compound medicine covered under any of the plans? I'm not exactly sure what you mean by compound medicine. We can get we will have a PDL, the whole sheet that has the list of all the different prescription drugs that are covered and what tier they're considered. That will be available here as we get more information from United Healthcare. I don't know if that helps answer anything, but we will get that information over to you and post it on the portal as well. Okay. Any other questions at the moment on the medical plans? We'll kind of dive into the rest. All right. Perfect. Okay, so the next few pages are pretty educational, so I'll kind of just do a high view of them. We really like to include this information for you because we're all consumers of our healthcare, and as we all know, healthcare costs a lot. So we want to be able to utilize those benefits the best that we can and make sure you know everything that is available to you to use. Again, I can't stress the My UHC website and mobile app enough. That has a ton of great tools. So make sure you're using that and looking at it to see all the tools and things available to you. Beyond that, you do have virtual visits that are provided to you through United Healthcare. The provider is Teladoc, but it's through the My UHC. You'll register through United Healthcare Teladoc. With that, again, I think we're all a lot more familiar these days with virtual visits. However, always a good thing to remember that you have. It can save you a ton of time. It can save you a ton of money sometimes using a virtual visit versus an ER visit, if that applies. And it also is just something, you know, if you don't have to waste a half a day by going and sitting in a doctor's office. You can get a phone call and they can call you back at work for that matter, if it's something as simple as a sinus infection. So remember that you have it, utilize it as much as you need. They will tell you, you know, we can't tell for sure. We can't treat that via virtual visit. We do suggest you go in somewhere else, but they can definitely treat a lot of things and it saves time and dollars. All right, I see a couple more questions in the chat here. Except for the high deductible plan, I don't have to meet the deductible before the insurance starts covering prescriptions. Yes, that's correct. Only the high deductible plan has the deductible needs to be met before the copays kick in on the prescriptions. The other three plans, the base, mid, and buy-up plans, all those copays are applied immediately. And where is this PDF posted available? Okay, so the benefit guides have not went out yet. We are getting a few final things done on it, and those will get sent out to you here before Wednesday for sure, before your open enrollment meeting starts. So we're going over it now. We'll get the final copies and along with some flyers and additional information out to you here before open enrollment actually starts on Wednesday. And while I'm talking about that, just to be sure, so we're going over the meeting now, we're going over the benefits now, just to kind of get it, you know, in your brains and something to start processing and thinking of. We'll get you the material as soon as we can get it out here. And then beginning Wednesday, you will be able to log into your portal and make your elections that way. And you'll have a week up until the next Wednesday. I forgot the date, which is the 15th. So by the 15th, you will need to have made your elections in the portal and get those completed and done. And please do not make Christine and Kristen chase you down on that. It's actually very important that we get those done timely and on time so that we can get the enrollment and elections over to United Healthcare for processing so that everybody can be in the system enrolled and effective as of the 1st of March, and then getting member ID cards out to everybody as well. Okay, so let's see, a couple more questions here. For clarification, is HSA accountable transfer, but that would be managed by the employees themselves? That is correct. So you can, once those HSA dollars, once they're in your HSA account through MCSG, those are yours. MCSG does not have access to them. They don't go away. And you can transfer them to another HSA, do with what you want. They're pre-tax dollars. But yes, that just all is managed by you. It's a true savings account owned by you. And then another question, when you hit the deductible, do you still have a copay for medications? Yes. So I'll flip back real quick here. So on the mid and buy-up plan, for example, once you've hit this deductible 2,500, you're still going to have copays that will be applied because you're still your out-of-pocket max is $6,000. So I believe, actually, that's a good question. Will you be paying the actual copay dollars for a pharmacy? Yes. For the other visits, I don't know exactly how that works, but we can get, I guess, a little more clarification on that. But yes, you will still be you will still, once you've hit that deductible, you'll still pay your copays on pharmacy up until you've hit this out-of-pocket max. Once you've hit this out-of-pocket max, that's when everything's covered at 100%. Okay, when you hit the out-of-pocket max, no. When you hit the out-of-pocket max, no, then that's when everything is truly covered at 100%, as long as it's in network, of course. So all in-network benefits after that out-of-pocket max is hit is no longer, you will no longer be paying any type of copay or any other dollars, correct? All right. One more quick question. Okay, so Frank, instead of addressing this right now, I actually did talk with Christina about this a little bit, and I believe she has the information that you emailed her on that. So she's going to get that information over to me. I'm going to get it with United Healthcare, and we'll get you a more detailed answer specific from them. If there's anything you want to add, definitely let us know, but we will be in touch with you on that for sure. Okay. So to keep going here, next pages are, sorry, I'm flipping around here. Okay, so this is, I always like to really refer to this on annual visits on preventive care. So again, all 4 plans that you have are preventive care is covered at 100%. There's just some things I definitely like to point out on preventive care to make sure you're utilizing that benefit as much as you can. So again, preventive care includes services such as annual physicals, routine well women visits, well child exams at certain ages, colonoscopies and mammograms. Everything that's considered preventive is covered at 100%. However, there's kind of some rules that go into that and some things to be aware of. So again, this is more so a cheat sheet. Of course, confirm your physician is in network when you're making your preventive care visit. If they're not in network, it will not be covered at 100%. When you are scheduling your appointment, make sure that you are letting them know this is for your preventive care visit, so that they enter it into the system correctly. They know that's what you're actually there for. And the third part to that is you are allowed 1 preventive care physical every 12 months. So be sure, a lot of times if you're going back to your same physician, they'll have it noted, but again, just to be sure on your end, make sure it's every 12 months. So if you went to the doctor in November for your physical last year, and then this year you wanted to go in October, that wouldn't be a full 12 months per se on this plan. And so therefore that would not be considered preventive. Again, your physician's office, if you're going to the same one, should have that noted, but definitely something to keep in mind on your end as well. And then the 2 major things to really point out, when you're at the office for your physician or for your physical or annual exam or whatever you're getting done for your preventive care, these things can very quickly turn into diagnostic things. So a lot of times, your doctor will say, hey, I want to get some additional blood work done on you here, or you have some questions that you want to bring up, and they end up doing some additional things. Or after, if you're getting some type of scan, colonoscopy, for example, and, polyps or something are found, those can quickly turn into diagnostic, which at that point is no longer considered preventive, and then you will be billed for that. The thing I like to just remind you of, it's not to say don't get it done or don't go on with the blood work or don't get the additional tests or things that they want to be done. Just be aware that this can happen. And so you don't get a surprise bill afterwards, like, wait, I thought this was all covered at 100%. So if your doctor is suggesting additional blood work or anything like that, just always ask the questions. Ask, is this still considered preventive? Will I be billed for this? How does this work? And at that point, at least you're prepared and you can make the decision. I'll come back later at a different time, or I'll go through with it and I just know that I'm going to eventually get billed for this otherwise. So again, just to educate and make sure you're aware and kind of know how that works, ask the questions if you're unsure of what that's going to look like for you. And then the second part to that is if you are going somewhere else to another facility, I know a lot of times, they'll send you across the street to get some blood work done or down the hall to, get this done. make sure that facility is also in network. We like to think our provider is going to send us to an in-network provider, but it doesn't always happen. So that's where your My UHC mobile app can come into handy. You can just plug that in real quick and make sure that facility is listed as in network, or you can even have them ask. So just some key things to remember and make sure you're getting the most out of your preventive care visits. The other thing to remember, if you are asking a doctor's office specifically, are you guys in network with United Healthcare? Be very precise, I guess, on how you use the wording. We've had it way too many times where somebody says, "Do you take United Healthcare?" And they're like, "Yes, of course we do," but that doesn't mean they're in network. So, are you in network with United Healthcare? And then again, you have that Choice Plus network name. Are kind of the key things to remember when you're making that determination. Okay, where can we get a list of which doctors are in network? So again, the best way to do this is on the website. And again, I will get a flyer over to everybody as soon as possible, as soon as I get it from United Healthcare. We're still in the phases of getting information back from them, but along with the benefit guides and all that, I will get flyers to help you kind of walk through how to find my provider. But it's on the website, and you can go there, look up, find my provider, use the Choice Plus network, and then search in the UC Health or whatever it is that you use and find out who's in network that way. There's not a list per se that we can just pull and print out. And if you need any help with that at all, definitely let us know, and I can help determine if there's some things that aren't clear for you on who's in network and who's not. Okay, so the next page, again, another quick cheat sheet. This is just, again, we thankfully have a lot of tools to use now. We have urgent care, standalone emergency rooms, hospital emergency rooms, convenience care clinics, so that are the ones in your pharmacies like CVS, where there's the care clinic within the pharmacy, your virtual visits, doctor's offices, all that. This is just a quick cheat sheet we like to provide to you to kind of show what costs you the least and the reasons for usage, type of care you can get, and all of that. So of course, we always advise you to start with the ones that are going to cost you the least, but we know that your doctor's office and virtual visits aren't always going to be the answer. So from there, we always suggest use your convenience care and urgent cares sooner or prior to your emergency room, and only use an emergency room if it's a true emergency. A few things to point out. So I always use my personal example. I used the convenience care clinic one time a few years ago when my son, he needed a physical done to start 7th grade football, and I failed as a mom and did not get that done for him, and I was not able to get him into his pediatrician for his physical on time. And so we just went over to I think it was a Walgreens convenience clinic, was able to get his physical done there. It didn't cost me any more. And they are even able to transfer those physical records over to his pediatrician, so they have them on file. But we were able to get all of it done. He could start football practice on time, and everything was good. So there's always other options available. Just know that you have them, and don't be afraid to reach out to your resources. And then the other thing to always be aware of are the standalone emergency rooms versus urgent cares. If they say emergency room on them, they are emergency rooms. They will bill you like an emergency room versus urgent cares. Those aren't always open 24/7. They're usually more open from like 8 to 8 time frame. So just be sure when you're going somewhere, if you think it's an urgent care, make sure it really is an urgent care. All right. Oh, thank you, Brian. He just provided some instructions on the group chat if you want to use that on how to exactly where to go. So thank you for providing that, Brian. Okay, so the next couple pages, we're going to dive into the HSA and FSA. Again, this is just a little more detail. So your HSA is available to you only if you are enrolled in the high deductible health plan, then you can have the HSA account. And with that, MCSG will contribute $45 monthly into your HSA for an employee only enrolled, and anybody beyond that, employee, spouse, children, or family will have $145 contributed into that HSA account. Then you yourself can also elect to contribute pre-tax dollars into that HSA. You can do it per paycheck. You can do it as a lump sum. You can do it however you choose. It's pre-tax, and you can make that choice on what you want to elect. You can change that throughout the year. So you can't change your medical plan, but you can change the amount that you are contributing into that account. That's not you have to decide now and then stick to it kind of thing. So those dollars are yours. They will not go away. It is not a use it or lose it. It works just like a savings account. It's under your name, and it is your dollars no matter what. The only thing stipulation around them is they must be used in order to keep the pre-tax advantage. They must be used for the qualified medical, dental, or vision expenses. Those expenses, there's a whole host of things they can be used for. They're outside of premiums, but again, your medical, your dental, I use mine for my dental and vision every year as well. But there will be a list of that on the Advantage Benefits Plus website, or you can just go to the IRS website and look at all HSA qualified items. I know people use it for LASIK surgery, all kinds of things. So definitely don't, remember that you can utilize those dollars for a lot of things. There are some things that keep you from being eligible. So make sure, I guess, that you are qualified if you have kind of a different situation. So as long as you're covered under a high deductible health plan, you can be enrolled. However, if you are covered on a spouse's non-HDHP plan, then you may not be eligible to have this is where the FSA, HSA thing comes in play. So if you're under a spouse's plan that is not a high deductible health plan, then you cannot, again, contribute to the HSA. If you're enrolled in Medicare, you can have the high deductible health plan. You just may not be able to contribute to the HSA. And then if you are a dependent on another person's tax return, claimed as a dependent, then you will not be able to contribute possibly. So these are all IRS rules. If you have any questions or any uncertainties around it, we have a specific compliance team. I'm not the specialist here. That we will get those questions to in a more clear and concise defined answer for you. And also we always advise if it's more around the tax side of things, we heavily and strongly encourage you to use your tax advisor's advice on that, not ours. We are just benefits people, so not your tax specialists. And then the IRS also sets a limit each year, a contribution limit each year for how many dollars you can contribute into your HSA. For the 2023 calendar year, you can contribute up to $38.50. And then for a family, it's $77.50 is the limits this year, or for the 2023 plan year. So when you're making your contribution elections, whatever you're contributing, just make sure you're accounting for what your employer is contributing to, so that you're not going over that amount if you're wanting to max that out. And that should all be calculated and available for you to see when you're making your elections on the benefits portal. Okay, I'm going to try to speed up here a little bit so I don't go over our time too bad. The FSA, again, this is a plan that has been available in previous years. It's through Advantage Plus Benefits Plus. It works very similar to the HSA. However, you can be enrolled in it if you are in just the regular PPO plan. This plan, however, the main difference between HSA and FSA is this is a use it or lose it. So whatever dollars you decide to the pre-tax dollars that you decide to have in your FSA must be used by the end of the calendar year, or eventually you will lose them. So for the health FSA, there is one exception. They do allow for carryovers. So in the event that you have FSA dollars left at the end of your plan year, you can carry over unused balance of $610 into the unused funds to remain. So there is a little bit of leniency there where you can spend those dollars down if you didn't get them spent by the end of the year. But again, when you're making those elections on how much you want to spend, just keep that in mind that these dollars aren't a true savings account like the HSA, and they will eventually go away if they are not spent. That 2023 IRS limit for your FSA is $3,050. And then there's also dependent care available, FSA available for you as well. That limit is $5,000 per family or $25,000 each for married filing separately. And you can elect one or both. You don't have to elect them all. You can just have the health, or you can just have the dependent care, or you can have them both, whatever is your choice there. Okay, where are the prices posted? So there is, we will get to the deductions page at the end of this. I'll go to that here before we get to the end of the hour for sure. But they will be available once the benefits portal opens up on Wednesday, they will all be listed for you so you can see your paycheck deduction amounts and how much everything costs that way. But there's also a sheet at the end of this that you'll see it. Okay, so I'm going to speed up quite a bit here to get through the rest of the benefits. Thankfully, not much has changed on the rest of it, so I won't spend too much time on it. So all of your other benefits are through Mutual of Omaha. Your dentist or your dental plan, there's two plans. There's a dental low and a dental high. The one thing that did change this year, we did add orthodontic coverage for children on the dental high plan. So if that's something you were really hoping for and wanting to use, that is now available to you on the dental high plan. Otherwise, nothing else has changed on the dental plan. So the low plan and the high plan both have the $50 deductible, the $1,500 calendar year maximum. Now there's a $1,000 lifetime limit for the orthodontia for children only on the high plan. And then the benefits themselves, so preventive covered at 100%. Basic is 20% after deductible. And then where the differences on the two plans go, so your major services are 50% after deductible on your low plan and 40% after deductible on the high plan. Beyond that, everything else is pretty much the same. If you have a dentist that is out of network, there is good out of network coverage. This 90th percentile basically means if you were to go to a dentist who is out of network, they still have to charge you within what 90% of dentists in your area charge for that specific service. So it keeps that out of network cost down if you do have a dentist that is out of network. Again, you can verify these benefits and verify your provider through Mutual of Omaha on their website. You can look that up, but again, this has not changed from last year. Same thing applies. The plan year is March through February, but the deductibles and out-of-pocket the calendar year maximum does run and reset every January 1st. Vision, nothing has changed on this. So mutualofomaha.com is where you can verify your provider for both dental and vision. Again, they use iMed's Insight Network for your vision, and then everything else is the same. So you can get your exam lenses, contact lenses every 12 months, frames every 24 months. Your eye exam copays are $10, glasses are $25 copay. And then you do get an allowance for frames or cosmetic lenses of $150 and then a percentage off that balance. Just keep in mind, it's one or the other. You don't get $150 each year for both of those things. It's one or the other that allowance applies to. Other than that, not a whole lot to point out there. And let's see, so you also have disability available to you through Mutual of Omaha. So short-term disability is provided at no cost to you. And it is a benefit that would take place after an injury, it would take effect immediately. After an illness, it would take effect after 7 days. And then it would be your annual salary. It would be 60% of your annual salary up to a weekly benefit maximum of $2,000, and it will last up to 13 weeks if that applies. If that applies to you at all. So that's always a good cushion to know that you have. Sorry, I don't know what I just did there. And then long-term disability is available for you to elect in addition to, that is voluntary. So you do need to elect it, and that would be, those premiums would be paid by you. That benefit begins after 90 days of injury or illness, and it is again 60% of your annual salary up to a monthly benefit maximum of $5,000, and would last you up to Social Security normal retirement age. So always good benefits to know you have. We never planned for it, but definitely good. Here's a calculator on how to calculate your long-term disability premium. But again, that will all be calculated and done for you in the benefits portal. So don't think that you have to do it this way. And then next is your life insurance. So MCSG Technologies does provide you a $100,000 life insurance, an AD&D basic life insurance policy at no cost to you. So nothing you need to do in order to enroll in that. You're automatically covered. Just to make sure you're designating your beneficiary. I always like to give a quick refresher on that. You can change your beneficiary at any time. I always like to use annual open enrollment as a good time to double check you have the correct person in there as your beneficiary. But be sure that you are updating that when you have a life event. Sometimes that's a good time to change them as well. And remember that you can. So please make sure you're checking that and make sure that's done. On top of the company paid life insurance, you can also elect voluntary life and AD&D on yourself, on your spouse, and or your children. You must elect additional coverage for yourself in order to elect coverage for your spouse and or children. And the way that it works, so there's 10,000, you can elect in $10,000 increments for yourself up to $500,000, not to exceed 5 times your base annual earnings. However, there is a guaranteed issue of $130,000. So if this is your first time electing life insurance, you can elect up to that without having to complete an evidence of insurability, an EOI form or a health questionnaire, whatever you want to call it. If you have waived in the past, but now you want to enroll, you would need to complete a health questionnaire in order to be approved for that. And if you currently have a life insurance plan, but you want to just increase it, you can increase it up to $10,000 if it's under this guaranteed issue amount of $130,000 without having to complete an evidence of insurability form. If you already have a $130,000 policy or more and want to increase it, you can. You just need to complete that questionnaire. It's a quick questionnaire. It's available on the benefits portal, and you can submit it real easily online, I believe. But again, it's not a hard task. It's just an additional step to be aware of in order to get approved for that amount. Mutual Omaha works directly with you. So once that's submitted, if they need more information, they will let you know directly. If they approve you, they will let you know. If they've declined you, they'll let you know that and the reasons why. But it all comes directly to you on that communication line. And then as far as your spouse and children go, if you want to add for your spouse, you can elect in increments of $5,000 up to $100,000. Again, they have a guaranteed issue of $50,000. So same thing applies. Anything over that, or if you've waived in the past and now you're adding, does require your spouse to complete an EOI. But other than that, you do have the option to elect up to that to $100,000. And then for children, you can elect in $2,500 increments up to $10,000. EOIs do not apply to children, so you can add them at any time. And that covers one or all children, no matter how many you have. It's one policy. Okay, and I am kind of speeding through this, so I apologize if I'm going too fast, but I want to be sure I cover everything before the end of the hour. Again, there's a calculator on the rates, but this will all be available when you're making your elections on the benefits portal. The supplemental plans, I will get more information in the guide on this. At this time, I just want to be sure that everybody's aware you do have a critical illness and accident insurance available to you through Mutual of Omaha. It's supplemental, so it's all employee paid. And we'll get more details on what that looks like and what the plans consist of. But critical illness is an option you can elect to cover you and or your family. And basically it's a lump sum of money that you would get in the event of critical illness, something like heart attack, stroke, cancer, any kind of major critical illness issue, then you would be eligible to have that lump sum dollars come to you to help cover whatever expenses you have in that event. So just an additional, like I said, supplemental income to have to help cover, give you some income in the time of something like that happening. And then your accident insurance, it covers any type of accident for whatever it is that's done. So for example, I have an accident plan on me and my 2 boys. My son injured his arm playing baseball, and we had an MRI done, and I was able to get file an accident claim on that and get reimbursed dollars towards that MRI. It didn't cover the whole MRI, but it's dollars back on whatever it is that on. For my instance, it was the MRI, but any type of broken bone, ambulance ride, anything, there's a whole chart of it. We will be sure we get that information over to you, and it will be posted on the benefits portal as well. But those are benefits that you can choose to add in addition to the other benefits offered. The rest of this has not changed. It's just some pages in the guide. So there's your time off and leave. There's your holidays, the 401k, there's no waiting period on that. But that's all in the guide as kind of quick information. And then at the very end, it's 2 minutes over, so I apologize. Here are the rates per paycheck. Again, these will be in the benefits portal for you to see when you're making your elections. But as you can see, the high deductible and the base plans are the lowest costing premiums. And then as you go up with the richer benefits, the premiums obviously increase. And nothing else has changed other than on the high plan, the children and family rates did vary some because of the additional ortho added. But beyond that, nothing else has changed. So sorry, I went a little bit over. Is there any other questions I can stay on? I know other people might have to run, but I can stay on if people have questions. If there's anything you want to add, Christina or Kristen, feel free. Otherwise, I am done.
No,
all right.
I'm good. If anyone has any additional questions, let us know.
Yes, thank you. And we will be sure we get this additional information out. I said I have notes, and I will be sure we get some of those things communicated a little more clearly. The benefits portal will be open on Wednesday. The guides and other flyers and information will be sent out to you prior to that. But feel free to let us know if any other questions come up. All right. Thanks everybody for joining. Have a good rest of your day.